Hi, in this video we're going to cover rescue breaths. There are a plethora of ways we can deliver a rescue breath, but for the purpose of this video we're going to use mouth to mouth. Now before I go into how we do mouth to mouth, I just want to go over a few things with you. Now I know there's a few of you out there that may be uncomfortable about delivering a mouth to a patient. Maybe that's because you're afraid that you might catch an infection, that you're afraid of touching their saliva or spit with your lips. And I'm here to say that that's understandable. And in a case of CPR, if all you've got is your lips and you don't want to deliver rescue breaths using your own lips, then you're in your rights to say no. What I will say to you that if you're not going to do rescue breaths is please give adequate chest compressions at a rate of 30. But don't stop at 30. I want you to carry on delivering chest compressions until either you get tired, unless another bystander can come up and take over, or until the emergency services arrive. So recap, if you don't want to deliver mouth to mouth, just keep on delivering chest compressions until help arrives. So then, how do we deliver effective mouth to mouth on a patient? It's very, very simple. I'm going to take you through the process. One important thing though, guys, before we start the process is the airway. We need to make sure the airway's clear. So before delivering a head tilt chin lift, we're going to make sure that the airway's clear. What we don't want to happen, guys, is if there's something stuck in their throat, like a piece of food, a sweet, some chewing gum, any debris that may be in their mouth, when we're actually opening up the airway, what we don't want to happen is the actual food to go straight into their throat. It's going to cause them more harm. Okay? It's a very simple technique that we can use. All we're going to do is just going to slightly open up the airway, check in the mouth. Is there anything in the mouth? If there's something in the mouth that you can see, if it's easy just to wipe away, just use a finger, just a little finger to wipe it away. If you've got any tweezers, anything that's safe to use, guys, you can just pull the debris out, okay? Assuming that there's nothing in the mouth and the mouth is clear, then it's safe to open up the airway and to continue using our two rescue breaths. To do this, guys, we're going to use one hand and place it on top of the forehead. We're going to use the other hand using two fingers and place it underneath the chin. And all we're going to do is exactly what it says. We're going to head tilt and chin lift. Can you see that motion, guys, as I'm doing it? Head tilt, chin lift. To deliver effective mouth to mouth, we need to make sure that we've got adequate covering around the mouth. We need to make sure the seals are completely tight. When you've opened up the airway, we need to deliver two rescue breaths, around about 1 to 2 seconds per rescue breath, but we need to give a tight seal around the mouth. To do this, we're going to use our right hands with two fingers and just place our fingers over the nostrils and pinch. With our mouth, we're going to complete a tight seal around the patient's mouth and we're going to deliver the two rescue breaths. A good way to show that you have got a good seal is just watch with your eyes the chest rise and the chest fall. If you see it rise and you see it fall, you've got great air suction around the mouth. Two fingers on the nose, straight down, two rescue breaths. Watch the chest rise and fall. Can you see the chest rise and fall? That indicates that I've got a great seal around the mouth. Let's do it in real time, very, very quickly. You've checked in the mouth, everything's clear. Hand on one forehead, two fingers underneath the chin, head tilt, chin lift. Pinch the nose, go down to the mouth, get a good seal, look at the chest, two rescue breaths. Did you see the rise and fall of the chest? Great. So now let's try it all together. So with the 30 chest compressions and the two rescue breaths. Again, for those that aren't comfortable with this, just carry on chest compressions until help arrives or you get tired. So we've approached the casualty, we're looking in the mouth, checking there's nothing there. Once happy, hand on the forehead, two fingers underneath the chin, head tilt, chin lift, fingers over the nose, and rescue breaths. Let's carry on in real time. Okay, so 30 chest compressions. Straight over the chest, knees to the patient, and deliver 30 just below the actual chest bone. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 29, 30. Head tilt, chin lift, finger over the nose. And back to 30 chest compressions, guys. It's as simple as that.